Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Federal datasets don't always die dramatically. Sometimes they lose a variable here and an update there, and they slowly drift into the statistical afterlife. In this installment of the Data Dish, we take a closer look at which federal datasets have truly flatlined and which are merely hanging on. Joining me are Denice Ross and Chris Dick. Denice is Director of Federal Data Policy at the Federation of American Scientists. Chris is a data scientist, demographer, and founder of Demographic Analytics Advisors. Denice and Chris, thank you both for joining me. We are here for episode 2 of the Data Dish.
Great to be here.
Great to be here.
Denice, you wrote last fall that the number of truly terminated federal data sets was actually much smaller than many people assumed. You called them dearly departed data sets. What have you learned since then about what's really happened as you've tried to go at this a little bit more systematically?
The number 3,000 keeps coming up when people talk about how many federal data sets have been removed, but that number is still based on an errant analysis of the data.gov website, which was taken just in the first few weeks of the administration. And when I see a big number like that, I want to list. I want to name names about those data sets. And so that's what we've been working on. That's what that initial Halloween crowdsourcing of data sets that had been terminated or variables that had been removed. And we've upped our methodology since Halloween, and Chris and I have been working on defining what constitutes a data set and what constitutes a termination.
Chris, when you started building this list, what turned out to be harder than expected? As Denice just kind of said, there's a gray area here between living data sets and dead ones.
Yeah, absolutely. So I think the really hard thing here is what actually counts as a data termination. And when I think of a data termination, I really think of 4 things. The first is kind of the scope of the universe of what we should be measuring. The second is the unit of analysis. The third is when we should measure the thing, what the measurement window is. And then is it above or below baseline for data terminations? So when we talk about scope of universe, really there's an easy thing here. And that is when an agency ends a primary data collection. So this is like when the CPS food security supplement was ended. That's a survey that the government does. The judgment call really comes when we start talking for scope about derivative and modeled products. So these are things like community resilience estimates equity supplement that the Census Bureau did, which is an index and a model of data that's pulled together from many different sources. Another one is the $1 billion weather and climate disasters data. So these are things where we're pulling together multiple different data sources, but they're not necessarily easily created again outside of government. So really defining that scope is where we first have to go. But then the unit of analysis, and this is where we get back to the 3,000 number, is really important as well. So when we think about something like the American Community Survey, big survey that the Census Bureau does, the Census Bureau releases dozens of files for the American Community Survey, but it's really just one data product. We can't count that over and over again. That's really one way that we get to that 3,000 number. And the time over which we measure also matters a lot. Something that's terminated isn't necessarily always terminated forever. The Social Vulnerability Index was terminated and then came back by court order. The Household Pulse survey from the Census Bureau, their gender identity fields, returned by May 2026. So our count, really when we're looking at things, we're measuring multiple times and updating this over time. The final thing really is, are these things above or below baseline? And this is honestly kind of the hardest part because data terminations do happen over time. Sometimes data sets or fields in a data set don't need to be collected anymore, and we terminate that data set or that field. What we're trying to do is highlight all the terminations and then note when things are above or below baseline. Something above baseline being things like the CPS food security supplement termination.
That is a really helpful description of what's going into this consideration. And so, Denice, give us some examples. What's on the list?
Yeah, and first I'll start with what the newest number is. It's 27. So I just want to make sure, like, we're looking at data sets numbering in the dozens when you're talking about actual terminations of data sets. If you look at variables that have been removed, then it's numbering in the hundreds when you look at gender identity and race and ethnicity that have been removed from data sets. But just a sneak peek into what our analysis has found. I'll give you 3 data sets that made the list this time. The first that was removed is Department of Homeland Security's Immigration Enforcement Monthly Tables, the department's own statistics that includes numbers on people who have returned to their country of citizenship or a third country. That data set stopped being updated on January 16th, 2025. So that means that during the largest enforcement push in decades, the official numbers went dark on repatriation. Another one that we learned about just through happenstance was the State Department's U.S. Embassy air quality monitoring. And historically, embassies have reported air quality in cities around the world. And that has provided an unbiased yardstick against local officials' numbers. And there's actually a body of research that shows that monitoring these air quality data around embassies has led to real reductions in fine particulate pollution in other nations. And the third example is the Pregnancy Risk Assessment Monitoring System, affectionately known as PRAMS, from the CDC. And that's our nation's main window into infant and maternal mortality. And it's available at the state level. And the 2023 data were collected, but never released by the CDC. And the state grants that ran that data collection expired this past April. It's worth noting that states can still release their own data, and collection continues by states, but the staff at the CDC just isn't there anymore to do the work on creating a standardized national file. And all 3 of these data sets, from State Department, CDC, and DHS, none of these had a formal announcement about their termination.
Denice Ross is the Director of Federal Data Policy at the Federation of American Scientists. Chris Dick is a data scientist, demographer, and founder of the company Demographic Analytics Advisors. Chris, let me come back to you. As Denice is talking about 27 that have been terminated, obviously there are lots more that are still up there. But if I open a federal data set today and it looks perfectly normal, what's the most urgent warning sign or the most important warning sign that its long-term health may be deteriorating?
Yeah, absolutely. I will say, I think this is a great question for Denice if we want to go there, but I can also hammer at it if you would like me to.
You take your whack and then Denice can add on.
Yeah.
Okay, that sounds great. So when we think about data health, really this is something that we measure a lot at dataindex.us. And we really think about 6 pieces of health when it comes to data collection health. The first is, are the data still available historically? So that's a lot about what we're talking about right now. So if you opened a data set and it was still there, you would notice that this historical availability is still there. Then we need to start looking at future data availability. And that's where a lot of these terminations come into play, but also how people are talking and how policymakers are talking about data. The other things that we need to know are data quality, statutory context, staffing and funding around the data, and then the policy context. So when it comes to data quality, this is where we know if things like sample size have decreased, if the number of sensors have decreased measuring a thing, or if the level of granularity has decreased, we know data quality is that's a good proxy for data quality decreasing. Statutory context is interesting because many of the data sets the government collects are collected either because they're required to do so or because the government is allowed to do so. Most data sets fall under the allowed context. And so if the government is only allowed to collect the data, that kind of raises another flag that data set could go away in the future. Staffing and funding is a really, really hard one. And this is where we need people to actually collect do quality assurance and publish the data. And if those folks have been RIF'd, or if they have left through voluntary retirement or other programs, finding out information about that can be really, really important for that data set. And finally, if policymakers are saying bad things about a particular data set or they don't meet kind of administration policy, that we also know is something that can create levels of risk for a data set.
Denice, who notices these kinds of losses first? Is it researchers? Is it state and local governments? Or does the public feel the loss before they really even know about it?
The first people to feel the loss would be the data users. Often that's in state and local government. One of the challenges is that often the data users might not be aware that there's a larger ecosystem they can tap into. So we do encourage anybody who is using a data set and notices that it's gotten skinnier or it was supposed to be released last month and hasn't been released, please email us at removals@dataindex.us so that we can put it into the queue for tracking. But also, we're finding that former feds who worked in agencies, they often have data sets. In fact, just yesterday, I was talking to somebody at the EPA, former EPA employee, who was annoyed that some data had disappeared. And so there are data sets that former feds watch. And what's fabulous about having former feds as colleagues, we've brought on 3 at the Federation of American Scientists, is that they can understand the impact of staffing losses and contract cuts on the data quality and likelihood that the data will keep flowing. And then in terms of, the American people, the general degradation of federal data, the impact will be hard to pinpoint. But one example is, so a couple of years ago, I got an email from my online grocery store that the peanut butter in my pantry could possibly have salmonella in it. And at first I was creeped out, like, oh, how do they know what's in my pantry? And then, just in the last 6 months, I realized that was because of federal data. That's because the Food and Drug Administration publishes a data set on product recalls, and the companies that sell us food, if they know who we are, they know we've purchased that peanut butter, and then they can send us a warning about the possible salmonella. So that's a federal data flow that I totally took for granted until I started doing this data policy work.
And the two of you have a couple of products out where data users might be able to check their concerns about these data sets. Chris, tell us about those.
Yeah, so I'll start with dataindex.us, and dataindex.us is the place where we actually monitor all of these federal data as much as we possibly can, and really try to show data can be alive but still unhealthy, and collected but never published. And so really, this is where we're looking at the overall health of federal data, not just those obituaries, not just the dearly departed data at dataindex.us. And then maybe I'll pass it over to Denice to talk about her beautiful site, essentialdata.us.
Yeah, one of my big regrets after leaving the administration as the U.S. chief data scientist was that we hadn't done a good enough job about telling the story about why these data matter to everyday American lives and livelihoods. And we've got now a collection of more than 100 data sets, and that we have one sentence love letters to them and how they benefit everyday Americans. And that includes, like, if you're taking your family on a vacation, your plane is less likely to hit a flock of birds because of the NOAA's NextRad data, so pilots can avoid birds. Or if you are trying to save money on the drugs that you need to take each month, the FDA has a generic drug equivalent, an official data set that crosswalks between generic drugs and their brand name equivalents.
Denice Ross is the Director of Federal Data Policy at the Federation of American Scientists, and Chris Dick is a data scientist, demographer, and founder of the company Demographic Analytics Advisors. Thank you both for joining me for episode 2 of The Data Dish.
Thank you.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.